Hey there, fellow Americans. Breaking news that could make your holiday season a lot merrier. President Donald Trump is making waves with a groundbreaking holiday relief proposal, and Congress is actually listening. This could mean an extra $3,000 in your pocket if you're receiving SSI or SSDI benefits. Don't forget to hit that subscribe button and notification bell to stay updated on the latest news affecting your benefits. In a stunning development that's sending shockwaves through Washington, President Trump has unveiled an ambitious holiday relief plan targeting Social Security beneficiaries, particularly those receiving SSI and SSDI payments. The proposal, which has gained unexpected bipartisan support, aims to provide a one-time payment of $3,000 to eligible recipients just in time for the holiday season. This unprecedented move comes as millions of Americans continue to struggle with rising inflation and mounting economic pressures. The proposed relief package, dubbed the Christmas Economic Relief Initiative, has caught many political observers by surprise, especially given the typically contentious nature of benefit-related legislation. Trump's announcement came during a recent rally where he emphasized the importance of supporting disabled Americans and senior citizens during the holiday season. Our SSI and SSDI recipients deserve better, Trump declared to a cheering crowd. These are hard-working Americans who've paid into the system, and now it's time for the system to work for them. What makes this proposal particularly noteworthy is the unusual alliance forming in Congress. Both Democrats and Republicans are showing signs of cooperation, with several key leaders from both parties expressing support for the initiative. The proposed $3,000 payment would be tax-free and wouldn't affect recipients' regular monthly benefits or eligibility for other assistance programs. This crucial detail has helped garner support from fiscal conservatives who might otherwise oppose such a measure. The timing of this proposal is particularly significant, as many SSI and SSDI beneficiaries have been disproportionately affected by recent economic challenges. With inflation hitting essential items like groceries and medications particularly hard, this additional support could provide crucial relief during the expensive holiday season. The proposal includes provisions for expedited processing, potentially allowing payments to reach beneficiaries before Christmas if approved in the coming weeks. Congressional analysts have been working overtime to assess the fiscal impact of the proposal. Initial estimates suggest the total cost would be approximately $165 billion, targeting roughly 55 million eligible beneficiaries. While this is a substantial sum, supporters argue that the economic stimulus effect could help boost local economies as recipients spend these funds on essential needs and holiday-related purchases. The proposal includes specific funding mechanisms, including temporary corporate tax adjustments and reallocation of unused federal funds from other programs. One of the most innovative aspects of the proposal is its implementation strategy. The plan calls for utilizing existing Social Security Administration infrastructure to distribute payments, potentially allowing for rapid deployment once approved. Recipients would not need to apply separately for these funds. Instead, the payments would be automatically processed for those currently receiving SSI or SSDI benefits. This streamlined approach has received praise from advocacy groups who often criticize the bureaucratic hurdles in benefit programs. The proposal has also sparked discussions about longer-term reforms to Social Security programs. While this is intended as a one-time payment, several lawmakers have suggested using this as a launching point for broader discussions about permanent benefit increases and program modernization. Trump's involvement has surprisingly brought some Republican lawmakers to the table who had previously been resistant to benefit expansion discussions. Support for the proposal extends beyond political circles. Several prominent economic experts have weighed in, suggesting that targeted relief of this nature could help prevent economic hardship without significantly contributing to inflation. Dr. Sarah Martinez, a leading economist at Capital University, notes, while general stimulus payments can potentially fuel inflation, targeted support to fixed-income beneficiaries typically has a more stabilizing effect on the economy. The proposal includes specific provisions for different categories of beneficiaries. Those receiving both SSI and SSDI would be eligible for the full $3,000 payment, while individuals receiving only one of these benefits would still qualify for the complete amount. This inclusive approach has been praised by disability advocates who often point out disparities in benefit programs. Consumer advocacy groups have been particularly vocal in their support, highlighting the potential impact on recipients' daily lives. Mary Thompson, director of the National Disability Rights Coalition, explains, For many of our members, $3,000 could mean the difference between choosing between medications and holiday meals or being able to afford both. It's not just about holiday cheer, it's about dignity and basic needs. The implementation timeline proposed in the legislation is ambitious but achievable. If approved, the Social Security Administration would begin processing payments within 2 weeks of the bill's signing. The proposal includes funding for additional temporary staff to handle the increased workload and ensure timely distribution of payments. Recipients would receive notifications through their usual communication channels once their payment is processed. An interesting aspect of the proposal is its potential economic multiplier effect. Economic analysts suggest that because SSI and SSDI recipients typically spend rather than save additional funds, the money would quickly circulate through local economies. This could provide a boost to small businesses during the crucial holiday shopping season, creating a ripple effect of economic benefits beyond the direct recipients. The proposal has also gained support from various religious and community organizations who see it as aligned with the spirit of the holiday season. Several prominent religious leaders have praised the bipartisan effort to provide assistance to vulnerable populations during this significant time of year. This broad-based community support has helped maintain momentum for the proposal despite typical political gridlock. Critics of the plan have raised concerns about its impact on the federal deficit, but supporters point to several offset provisions built into the legislation. These include temporary adjustments to corporate tax structures and reallocation of unspent funds from previous relief packages. The proposal also includes measures to prevent fraud and ensure payments reach intended recipients efficiently. The Social Security Administration has already begun preliminary planning for implementation, should the proposal become law. This includes updating computer systems, preparing communication materials, and developing distribution protocols. The agency's proactive approach could help ensure smooth deployment if the legislation passes. Recipients would be able to track their payment status through the existing SSA online portal or by phone. Healthcare providers and medical professionals have also voiced support for the proposal, noting that many of their patients on SSI and SSDI often struggle with out-of-pocket medical expenses. The additional funds could help beneficiaries address delayed medical care or stock up on necessary supplies without sacrificing other essential needs. This health-related aspect has helped strengthen the argument for the proposal's necessity. The proposal includes provisions for expedited appeals processes for any recipients who believe they were incorrectly excluded from the payments. This administrative safeguard has helped address concerns about fairness and accessibility, particularly for beneficiaries who might have complex situations or recent changes in their benefit status. Looking ahead, many political observers see this proposal as potentially setting a precedent for future cooperation on benefit-related legislation. While designed as a one-time payment, the bipartisan support it has generated could pave the way for more comprehensive discussions about Social Security reform and benefit adequacy. The timing of the proposal's consideration is crucial, as Congress faces end-of-year deadlines and budget considerations. However, the unusual level of bipartisan support has created optimism about its chances for passage. Leadership in both chambers has indicated a willingness to fast-track the legislation, recognizing the importance of getting assistance to beneficiaries before the holiday season. As this proposal continues to move through the legislative process, advocacy groups are encouraging beneficiaries to stay informed and engaged. While the proposal appears to have strong support, they emphasize the importance of continued public interest and support to ensure it crosses the finish line. The coming weeks will be crucial in determining whether this holiday relief becomes a reality for millions of Americans.